In today's Zooplus magazine, we're going to take a look at the topic of urinary tract diseases in dogs. The symptoms can be quite complex and can occur in different combinations. We'll give you an overview and some helpful tips in case your pet is ever affected. Some symptoms are difficult to spot, which means they can go unnoticed for some time. But there are some clear symptoms and behaviours that will indicate that your dog may have a urinary tract problem. In this case, Rosie's owner noticed that she was more restless and was licking her genitals and backside more frequently and intensively. Alongside this, Rosie had urinated in the apartment, which was completely out of character for her. There were also signs of blood in the urine stains. If your dog suddenly seems to be having accidents in the house, it could be due to an avoidance behaviour. This can be caused by associating their usual outside peeing places with pain, so therefore seek out alternative spots. On the other hand, it may be because the urge to urinate is simply too strong due to the infection. If you notice one or more of these behaviours, it's time to visit the vet. The first step at the vet's practice will be to establish basic facts about your dog's medical history. This will form the basis of getting to the bottom of the illness. Your dog's medical history is important because urinary tract diseases do not have just one single cause. Today we're going to focus on the most common causes. Statistically, cystitis caused by a bacterial urinary infection is the predominant form of urinary tract infection. Mostly, the culprits are germs like intestinal bacteria that can ascend from your dog's behind via the urethra into the bladder. Female dogs are more likely to be affected because they have a shorter urethra. Incontinence is often referred to as bladder weakness. Here too, factors like age, breed, previous illness, castration, and physical condition can play a major role. Urinary stones form when urine is supersaturated with certain minerals. Depending on the minerals involved, a distinction is made between types such as struvite, calcium oxalate, and urate stones. The patient will need to go through a whole set of examination steps to obtain a reliable diagnosis. First, the urine has to be analysed. This involves a microscopic assessment of urine sediment and evaluation of a test strip. If necessary, a bacteriological examination follows. If bacteria is detected, the appropriate antibiotic must be found. A blood test will help to rule out any underlying diseases. Significant values can be read in the blood plasma to provide further clues. The next step will be an X-ray and/or ultrasound scan, which can provide information about changes in the urinary tract and can show if there are any crystals or gravel formation. Depending on the initial picture and cause, further examination steps may be necessary until a final diagnosis can be determined. In our scenario, the following was found. The pH value of the urine was strongly increased, and urine crystals were found in the urine sediment. However, the images did not show any stones. This leads to the assumption that Rosie is suffering with urinary crystals. they will most likely be struvite crystals, as these are the most common. It also explains why Rosie is in pain, as urinary crystals are sharp-edged, they irritate the bladder wall and urinary tract. What is needed now is to dissolve the crystals, treat the inflammation, and stop any recurrence. The patient will be given anti-inflammatory medication to take home. This will help the bladder wall to heal. In consultation with the vet, the medication will be accompanied by a change in diet. A special diet will help dissolve the struvite crystals and prompt the patient to drink more to increase urine production. The formulation should be suitable in relation to mineral composition and pH value. It's important that you always follow the vet's recommendation, as the food must be optimally adapted to counteract the illness.
Gut, dann hat die Rosi schon geschafft für heute, gell? Super gemacht.
In our scenario, the vet recommended Urinary SO from Royal Canin Veterinary range. To support recovery in the best way possible and reduce the risk of urinary tract problems in the future, here are some more tips. To increase fluid intake, add some lukewarm water to dry food, or feed your dog wet food as part of their diet. Ideally, you should also place several bowls of water throughout your home. In general, it's important to keep an eye on your dog's weight. You can increase exercise in their routine by encouraging more play alongside their walks. Furthermore, if you take shorter walks more frequently throughout the day, preferably on different routes, your dog may mark more. This will help to increase urine excretion. Physical and mental exercise, play, and avoidance of conflict with other dogs will also help to ensure a low stress level. If urinary tract diseases are recognised in good time and treated effectively, the chances of recovery are very good. However, recurrence is common even after successful therapy, so it's a good idea to visit the vet for regular follow-ups. Zooplus wishes you and your pet all the best.